Cutting through the fat. Today we'll talk about how fats can keep you slim. Clinical nutritionist Courtney Little joins me in a few minutes to clear up the fatty confusion. I'm Bob Garvin. Welcome to Body Talk, episode 97. If you have any questions or comments about this podcast, send an email to lifestarmedia@gmail.com or visit us on Facebook at Body Talk Bob Garvin. People are popping over-the-counter painkillers like candy without even realizing how dangerous these drugs can be. I'm not here to scare you away from using these medications, but knowledge is power, and you should know that just because it's over-the-counter doesn't mean it's a harmless drug. Liver toxicity from acetaminophen is the most common cause of acute liver failure in the United States, and it can lead to liver problems even when taken at recommended doses, according to the Institute of Liver Studies at King's College Hospital in London. And a recent study shows that commonly used painkillers like Motrin, Advil, and Aleve can increase your risk of heart attack even in the first week of use. Overall, these drugs and others known as non-steroidal anti-inflammatory drugs, or NSAIDs, increase the risk of heart attack by 20 to 50% compared with people who don't use them at all. That study was published recently in the British Medical Journal. If you find yourself reaching into the medicine cabinet on a regular basis to ingest these drugs, maybe you should think about some alternative therapies as well. Massage therapy, acupuncture, foam rolling, and meditation have all been shown to alleviate pain without any serious side effects. There's no question that these over-the-counter drugs can be helpful in alleviating pain, but if you must take them judiciously and with the knowledge that they carry some serious potential risks. Now let's turn to clinical nutritionist Courtney Little, who talks about how healthy fats can keep you slim. Courtney is the owner of Nutrition and Whole Health Solutions in Bedford, Massachusetts. Courtney, welcome back.
It's so nice to see you. Thanks for having me back.
You know, the news has been huge lately about sugar and sugar being vilified, where fat has been vilified just for a long time. So now people are starting to get confused. Fat was bad, I was told. Now they're told fat is good.
I know. It is confusing.
It is, and the thing that really hurts, too, is once you start breaking it down, a lot of folks just don't understand it. The omega-3s, the omega-6 saturated, polyunsaturated. Where do I go? How much do I need? What are the ratios that's driving me crazy? You know, a lot of folks, and do we have some help here?
Yes, we have some help. We may need another segment on this because it's a big topic, but today the importance, what we're going to talk about is fat. So I think a lot of our listeners will remember there was this low-fat movement that happened in the late 80s and early 90s.
When everybody got fat.
Yeah, literally.
Yeah.
So, you know, there was Snackwell cookies, there was fat-free salad dressing, and we took out all the fat in our food and beverages and added in a lot of chemicals and sugar so it still tasted good. So it became lower calorie, no fat, but a surplus of chemicals and sugar, so it was still, you know, we were able to eat it. And what happened was, you can Google this and see the graphs, is when we took out all the fat and added in the sugar, diabetes, obesity, and a bunch of other top degenerative diseases started to go up. Okay, the percentage of these types of conditions in the United States, there was a direct correlation. So fat doesn't make us fat if we're eating the right types of fat. So we need fat to survive. Eating a low-fat diet can negatively affect our health by causing inflammation, poor cardiac health, digestive problems, poor memory, and actually make us gain weight. When we eat fat and the right types of fat, we're fuller longer, we have less cravings, and more willpower. Same thing with the right types of proteins, which we've talked about in different segments of Body Talk. We need to eat fat, but the right types of fat, in order to burn fat for an overall healthier body. Fat is also brain food, and it negatively can affect our mood when we're not eating the right types of fat. all right? And we all know that the incidence of depression and anxiety is kind of through the roof in the United States today. So here's a breakdown of some of the fats, okay? There's omega-3, omega-6, and saturated fats, which we're going to talk about today. Omega-3 fats are in the form of DHA, EPA, ALA, and have a variety of health benefits to help reduce inflammation. Think about all the incidence of arthritis. So many people have chronic pain today. So some of the top omega-3 foods are salmon, mackerel, grass-fed beef, flax seeds, chia seeds, walnuts, grass-fed dairy, and tuna. And a diet that's high in omega-3s has actually been shown to lower cholesterol, lower anxiety, arthritis, to help with infertility, to help with Alzheimer's disease, and major skin issues like eczema and psoriasis. So we, unfortunately, in the United States, over the past 20 or so years, have gotten too much omega-6 fats. Now, omega-6 fats are not bad. We just need the right ratio of omega-3 to omega-6.
That's where people get confused.
Very confused, and rightfully so, because it is confusing, because they'll, look up omega-6 fats and be like, wait a minute, there's so many health benefits, it's healthy for us. We just need both in our diet. We need omega-6, we need omega-3. So omega-6 fatty acids, just like the omega-3s, are essential fatty acids. They can only be provided to us through food and supplements. Omega-6 is not produced in the body at all, and they're very important to our health and our brain health. So some examples of omega-6 fats: safflower oil, grapeseed, sunflower oil, poppy seed oil, walnut oil, sesame seed oil. These are some examples of omega-6 fats.
Now, people are overdosing on these oils?
Well, and then vegetable oil.
Oh.
So vegetable oil and, processed soybean oil, which are also omega-6 fats, are literally in everything. So if you look at the food and the beverages that you're eating, you'll see a lot of those fats because it's cheap, and they just plug it into a lot of our food, but in surplus. So that's why the ratio has been thrown off, and we've been getting, on average, way more omega-6, not enough omega-3. And one of the reasons why, unfortunately, this ratio has been thrown off, for years they told us saturated fats were bad for us, okay? And some of the saturated fats also have omega-3s. So this is how it's got confusing. So some of the benefits of omega-6s are it helps to reduce pain, blood pressure, supports brain and bone health, which is great. Now, the saturated fats are not the bad guys as we were once told.
Boy, we were told that. Stay away from that. Oh my gosh, when growing up and just all the years, it was like, boy, if you had saturated fat, you were a bad person.
Totally agree.
You were going to die early.
Yes, and that's not what happened. So like I said, they're not the bad guys. In fact, they play many important roles in our body chemistry. Saturated fats are found in meats, coconut oil, dairy, butter, and nuts. They do not normally go rancid, even when they're heated when you cook them, okay? And they're usually solid or semi-solid, like coconut oil is semi-solid at room temperature. They play a vital role in the health of our bones. Think about how much osteopenia and osteoporosis are out there today. I mean, it's huge. People
always think about calcium in that.
Yes.
They talk about saturated fat.
Well, on that note, for calcium to be effectively incorporated into the skeletal structure, at least 50% of the dietary fats should be saturated.
Wow.
Yeah. So coconut oil, healthy meats, dairy, butter, all organic, the real stuff, nothing that's been tainted, are healthy saturated fats.
I love all that stuff.
I know, it's all the good stuff. And even, the nuts have the omega-3s in it, which we also need more of too. So I found a very interesting article by Dr. Mary Enig and nutritionist Sally Fallon, and I wanted to share kind of an excerpt from the article. It says, today heart disease causes at least 40% of all U.S. deaths. If, as we have been told, heart disease results from the consumption of saturated fats, one would expect to find a corresponding increase in animal fat in our American diet. Actually, the reverse is true. During the 60-year period from 1910 to 1970, the proportion of traditional animal fat in the American diet declined from 83% to 62%, and butter consumption plummeted from 18 pounds per person per year to 4. So during the past 80 years, dietary cholesterol intake has increased only 1%. During the same period, the percentage of dietary vegetable oils in the form of margarine, shortening, and refined oils increased about 400%. And those are the bad types of the omega-6 fats, okay? While the consumption of sugar and processed foods increased about 60%. So it's more about the processed foods and the damaged fats, or not the right ratio of fats, that's really going to negatively affect our cardiac health and cause more inflammation in the body.
I'm ready to embrace saturated fat again. I really am.
Thank you.
Into my
Good.
Courtney's fantastic information. I've got whole new thinking now on saturated fat, as I'm sure a lot of our listeners are going to be really surprised. Thanks so much for letting us know.
Thank you so much, and thank you to our listeners who keep listening. We love your questions and your feedback, and we love to educate you, so thank you.
Well, that's it for this edition of Body Talk. My producer is Katie Stell. The Body Talk theme song was composed by Rob Carlson and sung by Vicky Vox. If you'd like to stay up with medical studies on a daily basis, follow me on Twitter at BGPVideo. And if you have any questions or comments about this program, feel free to send me an email at lifestarmedia@gmail.com. Body Talk is a production of Lifestar Media.